Hello everyone. Welcome to the DocSaab's diary. Today we are going to do a comprehensive deep dive into one of the most talked about medications in modern medicine, Ozempic, whose generic name is semaglutide. Over the next few minutes, we will explore its pharmacology, mechanism of action, approved clinical indications, its remarkable role in weight reduction, dosing protocols, side effect profiles, drug interactions, and its current landscape right here in India. Whether you are a practicing clinician, a resident, or a medical student, this presentation is designed to give you a clinically accurate, evidence based understanding of semaglutide. So, let's get started. Let us begin with the basics. Ozempic is the brand name for semaglutide, which belongs to the drug class of GLP-1 receptor agonist, glucagon like peptide 1 receptor agonist. It is currently the most prescribed medication in this class worldwide. Primary indication Ozempic is a FDA approved and CDSCO approved for the management of type 2 diabetes mellitus in adults. It is intended to be used as adjunct to diet and exercise, not as a replacement for lifestyle modification. Now let's understand its mechanism of action because this is where it gets particularly elegant from a pharmacological standpoint. Semaglutide selectively binds to and activates GLP-1 receptors, which are found in the pancreas, brain, gastrointestinal tract, and cardiovascular system. This activation produces four key physiological effects. First, it stimulates glucose-dependent insulin release from the pancreatic beta cells. This is a critically important point. It only does this when blood sugar is elevated, thereby significantly reducing the risk of hypoglycemia. Second, it inhibits glucagon secretion from pancreatic alpha cells, which prevents inappropriate hepatic glucose production and helps keep blood sugar levels from rising unnecessarily. Third, it slows gastric emptying, which means food leaves the stomach more slowly, blunting postprandial glucose spikes and prolonging the sensation of fullness. And fourth, it acts centrally to reduce food intake and enhance satiety, which contributes to its weight loss properties, a topic we will explore in great detail shortly. Now that we understand the mechanism, let's look at the approved clinical indications and the broader therapeutic benefits of Ozempic. First, type 2 diabetes management. This is the primary FDA approved use. Ozempic lowers HbA1c by improving insulin release, slowing gastric emptying, and reducing hepatic glucose production. It is particularly valuable in patients who require both glycemic control and cardiometabolic risk reduction. Second, cardiovascular protection. This is a landmark indication. The SUSTAIN 6 and SELECT trials demonstrated that Ozempic reduces the risk of major adverse cardiovascular events, including stroke, myocardial infarction, and cardiovascular death in adults with type 2 diabetes and established cardiovascular disease. This is cardioprotective benefit goes beyond simple glucose lowering. Third, kidney health. Emerging evidence and regulatory approval support its role in reducing the risk of kidney function decline in diabetic patients with chronic kidney disease. This is of particular clinical relevance given that diabetic nephropathy remains a leading cause of end-stage renal disease. Fourth, off-label use for weight management. This is where Ozempic has gained enormous public and clinical attention. It often leads to significant weight loss, though it is important to emphasize that its use specifically for weight management alone is off-label. The dedicated higher dose formulation for chronic weight management is called Wegovy, same molecular, different dose and indication. And an important clinical caveat, Ozempic is not approved for type 1 diabetes and is not indicated for use in children. Always ensure you are using it within appropriate evidence-based indication. Let us now explore the science behind one of Ozempic's most clinically compelling properties, weight loss. As a GLP-1 receptor agonist, semaglutide essentially mimics the body's natural GLP-1 hormone, which is normally released from intestinal L cells in response to food. However, endogenous GLP-1 has a very short half-life, approximately 2 minutes. Semaglutide, on the other hand, has been engineered with a fatty acid side chain that allows it to bind to albumin, giving it half-life of approximately 7 days, which is why it can be administered just once a weekly. So, how exactly does it produce weight loss? Through 5 interconnected mechanisms. 1. It acts directly on the hypothalamus and brainstem satiety centers, increasing feelings of fullness and reducing hunger signals. Patients report eating smaller portions and feeling satisfied much earlier in a meal. 2. It modulates key appetite regulating hormones, including ghrelin, the hunger hormone. By attenuating ghrelin's effects, it fundamentally reduces the drive to eat. 3. Through its gastroparesis-like effect, the slowing of gastric emptying, it prolongs the time food stays in the stomach, thereby extending meal intervals and reducing overall calorie intake. 4. The cumulative result of all this mechanism is a significant reduction in a food consumption, creating a sustained calorie deficit over weeks and months, which is the physiological foundation of weight loss. 5. And lastly, by enhancing glucose dependent insulin secretion and suppressing glucagon, it improves overall glucose metabolism, reduces fat signals, and supports better metabolic health across the board. Now let's talk numbers, because the clinical evidence for semaglutide in weight reduction is genuinely impressive. Clinical trial programs. The STEP program, Semaglutide Treatment Effect in People with Obesity, was a series of pivotal trials that specifically investigated the higher dose formulation of semaglutide for obesity. These trials ultimately led to the FDA approval of Wegovy at 2.4 mg for chronic weight management. The landmark SELECT trial, published in the New England Journal of Medicine, demonstrated a 20% relative risk reduction in major adverse cardiovascular events in patients with obesity and established cardiovascular disease, even in non-diabetic individuals. This was a paradigm-shifting finding. Average weight loss in clinical practice with Ozempic formulation, patients typically achieve 5 to 15% average body weight loss with sustained treatment. With a higher Wegovy dose, weight loss exceeding 15% is commonly reported. Regarding long-term outcomes and sustainability, ongoing research continues to investigate the durability of these effects. It is critical to counsel patients that weight tends to regain if the medication is discontinued without concurrent lifestyle modification, making the drug a long-term commitment in most patients. In terms of comparison to other interventions, semaglutide demonstrates comparable or superior efficacy to older GLP-1 agonists like liraglutide. The newer dual agonist tirzepatide, which targets both GIP and GLP-1 receptors, is showing even higher weight loss percentage, representing the next frontier in this drug class. And from a real-world impact standpoint, the market for GLP-1 agonist has seen unprecedented growth, driven by proven efficacy, cardiovascular risk reduction, and expanding indications. Let us now move to the practical prescribing information, doses, and administration, because getting this right is essential for both safety and efficacy. Ozempic follows a gradual dose titration protocols, which is specifically designed to minimize gastrointestinal side effects during treatment initiation. Weeks 1 through 4, we start at 0.25 mg once weekly. This is a purely non-therapeutic dose. Its sole purpose is to allow the body to adapt to the medication and reduce GI side effects. Do not expect therapeutic glycemic or weight loss effect at this stage. Weeks 5 through 8, the dose is escalated to 0.5 mg weekly. This is the first therapeutic level for diabetes management. Weeks 9 through 12, we escalate further to 1 mg weekly. This is where significant weight loss begins to manifest more consistently in most patients. Weeks 13 and beyond, if clinically indicated and well tolerated, the dose can be titrated up to a maximum of 2 mg weekly for enhanced efficacy. Administration method: Ozempic is administered via subcutaneous injection using a pre-fill, easy to use flex touch pen. It can be injected into the abdomen, anterior thigh, or upper arm, all with equivalent bioavailability. Key administration points: inject once weekly on the same day, each week, at any time of day, with or without meals. Rotate injection sites within the same body region each week to prevent lipodystrophy or injection site reactions. If dose is missed, advise patient to administer it within 5 days of the missed dose. If more than 5 days have passed, simply skip it and resume the regular schedule. Off-label prescribing note: it bears repeating, Ozempic is primarily indicated for type 2 diabetes. It used for weight loss, while increasingly common, remains off-label in most markets including India. Always provide personalized guidance and document the clinical rationale. Every effective medication comes with a risk profile, and Ozempic is no exception. Let us go through the side effects systematically from the common to the serious. Common gastrointestinal side effects: These are by far the most frequently reported, particularly during dose initiation or escalation. Nausea, the most common complaint, vomiting, diarrhea, and constipation. The good news is that these symptoms are typically transient. They tend to subside as the body adjusts to the medication. They are most pronounced when starting the drug or increasing the dose, and the gradual titration schedule we discuss is precisely designed to mitigate them. Less frequent side effects, Ozempic face. This is the colloquial term that has entered clinical discourse, referring to the cosmetic facial changes, particularly loss of facial fat and more gaunt appearance that can occur with rapid, significant weight loss. It is not a direct drug effect but a consequence of the weight loss reduction itself. Headaches and dizziness have also been reported. Other important considerations, hypoglycemia risk. While semaglutide itself has a low intrinsic hypoglycemia risk due to its glucose dependent mechanism, the risk increases significantly when combined with insulin or sulfonylureas. Monitor closely and consider dose reduction of the concomitant agent. Dehydration related to reduced oral intake and possible vomiting. Ensure adequate hydration. Serious risk, please pay careful attention. Pancreatitis, acute pancreatitis has been reported. Counsel patient to report persistent severe abdominal pain immediately and discontinue the drug. Gallbladder issues, cholelithiasis and cholecystitis have been associated with rapid weight loss and GLP-1 use. Thyroid tumors, animal studies show an increased incidence of thyroid C cell tumors with semaglutide. While not definitely demonstrated in humans, Ozempic carries a black box warning and is contraindicated in patients with personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2. Stomach paralysis means gastroparesis. There have been alleged cases. While the mechanism is plausible given the gastric emptying slowing effects, clinical evidence is still evolving. Contraindications and pregnancy. Ozempic is absolutely contraindicated during pregnancy and should be discontinued at least 2 months prior to a planned pregnancy given the drug's prolonged half-life. Discuss family planning proactively with all patients of reproductive age. This slide covers the topic of growing clinical and regulatory concern, drug interactions, and the serious risk of compounded semaglutide. Impact on oral medication absorption. Because Ozempic delays gastric emptying, it can slow the rate of absorption of orally administered medications. This is particularly relevant for drugs with narrow therapeutic indices such as certain antibiotics, oral contraceptives, and anticoagulants. Clinicians may need to adjust dosing timing or dosages of co-administered oral agents to maintain optimal therapeutic effects. Interaction with insulin and sulfonylureas. This interaction deserves special emphasis. When Ozempic is co-administered with insulin or sulfonylureas such as glibenclamide or glipizide, the combined glucose-lowering effect substantially increases the risk of hypoglycemia. As shown in the interaction data, out of 275 reported interactions, 16 were classified as major, 250 as moderate, and 1 as minor. This highlights the importance of monitoring and potential dose reduction of the insulin-releasing agent. The compounded semaglutide problem. This is critical patient safety issue. Due to global shortages of branded Ozempic and the high cost of the drug, a market for compounded and unapproved versions of semaglutide has emerged, often sold online without a prescription. Here why this is dangerous. Compounded versions lack FDA safety, efficacy, and quality review. They may contain impurities and inconsistent dosing. There have seen 605 adverse events reports tied directly to compounded semaglutide formulations. There is a documented risk of fraudulent labeling, non-prescription sales, and most critically, dangerous dosing errors ranging from 5 to 20 times the intended dose. Such overdoses have resulted in severe hypoglycemia, pancreatitis, and hospitalizations. As clinicians and educators, we must actively counsel our patients about this risk and direct them to obtain semaglutide only through licensed pharmacies with a valid prescription. Now let us bring this discussion closer to home, the Indian clinical context. Ozempic's launch and availability in India. Ozempic officially launched in India on December 12, 2025, making it a very recent addition to our pharmacopoeia. It has been approved by the CDSCO for adults with type 2 diabetes as first-line or add-on treatment. It is available in the 0.25 mg, 0.5 mg and 1 mg flex touch pen doses. An important regulatory distinction, Ozempic is approved only for diabetes management in India. Despite its well-established weight loss benefits, its off-label use for weight loss requires specific clinical justification. It is available through licensed pharmacies as well as online channels, but patients must be counseled to ensure they are obtaining it through valid prescription from reputable sources to avoid the compounded versions we just discussed. Pricing and cost consideration, which is very real barrier for many patients. 0.25 mg doses weekly price in rupees is 2200 and weekly price in US dollar $24.35. 0.5 mg 2542 rupees, 1 mg 2794 rupees. This cost can represent a significant financial burden, particularly for long-term use. This is an important consideration in treatment planning and patient counseling. Alternatives and future outlook. Wegovy, the higher dose formulation at 2.4 mg specifically for weight loss, is pending availability in India. Ribelsus, the oral semaglutide formulation, is currently available in India, offering a needle-free alternatives for patients who prefer oral therapy. Tirzepatide, marketed as Mounjaro and Zepbound, is a next-generation dual GIP and GLP-1 receptor agonist, showing superior efficacy. Its Indian availability is currently pending. Retatrutide, a triple agonist targeting GLP-1, GIP, and glucagon receptors, represent the cutting edge of metabolic pharmacology. Indian approval is anticipated post 2026. A generic Ozempic wave is anticipated in India with several major pharmaceutical companies initiating manufacturing processes. This promises to significantly improve both affordability and accessibility in the coming years. As we approach the conclusion of this presentation, let us consolidate the key clinical takeaways. First, Ozempic as a GLP-1 receptor agonist has demonstrated proven multifaceted efficacy in managing type 2 diabetes and producing significant weight loss. Its benefits extend well beyond glycemic control, encompassing cardiovascular protection and kidney health, highlighting its remarkable versatility as a cardiometabolic drug. Second, optimal outcomes with GLP-1 agonist are only achieved when the drug is prescribed and monitored by trained healthcare professionals and integrated with holistic lifestyle changes, including dietary modification and physical activity. It is a powerful tool but not a standalone solution. Third, the field of GLP-1 agonist is rapidly advancing. New formulation, extended release platforms, and the emergence of dual and multi-receptor agonists such as tirzepatide and retatrutide are offering increasingly superior efficacy for metabolic health. Staying current with this literature is essential for modern clinical practice. Fourth, as these powerful medications become more widespread, we have a professional and ethical obligation to address equitable access, affordability, and responsible prescribing practices. The off-label use landscape must be navigated with transparency, informed consent, and clinical integrity. And finally, the pipeline for anti-obesity medications has never looked more promising. Novel mechanisms targeting multiple metabolic pathways are in development, and the coming decade may fundamentally redefine how we approach obesity as a disease, not just a lifestyle condition. And that brings us to the end of today's session on Ozempic semaglutide. I hope this presentation has given you clinically comprehensive, practically useful understanding of this remarkable drug, its mechanism, its evidence base, its risk, and its evolving role in Indian clinical practice. If you found this valuable, please consider liking, sharing, and subscribing to the DocSaab's Diary, where we regularly bring you in-depth, evidence-based medical education content crafted specifically for clinicians and medical students. Your feedback matters, it shapes what we cover next. Drop your thoughts and questions in the comments and do share this with your colleagues and batchmates who could benefit. Until next time, keep learning, keep growing, keep practicing with compassion and evidence. Thank you.